I want to welcome you to Lafayette Pain Care. We are in difficult times right now due to the COVID-19 outbreak and the rapid spread of COVID-19 around the world and the United States. And we know that this is heavily on your mind, and we want to publicly tell you that it's on our minds too. And we want to tell you what we're doing to take extra precautionary measures for your safety as well as our staff's safety. Please don't take any of these precautionary measures, however, personal. This is what the healthcare provider world has to do right now to keep all of our patients safe, as well as our healthcare providers. First, let me tell you what we have done to heighten our infection prevention protocols. You will notice our healthcare providers will be wearing masks. We may ask you to wear a mask as well if you have answered positively to being exposed to others in your circle of family, friends, or coworkers. Secondly, you'll notice our staff routinely wiping down high-touch spots with disinfectant wipes, both in the clinic as well as out in the waiting room. Those high-touch areas will be door handles, arms of chairs, countertops, and bathroom facilities. And again, please don't take this personal, and we're not targeting you if we happen to be out there doing it at the same time that you're here. Thirdly, our staff will be performing hand washing before and after patient care according to the World Health Organization and CDC's hand washing protocols. We'll be using hand sanitizer as well, but nothing really takes the place of thorough hand washing. You will notice that our providers will be wearing latex gloves after their hand washing and during your patient care, and those gloves will be discarded after each patient. For your peace of mind, we want you to know that our patient treatment rooms and surgery center areas are being disinfected after each patient treatment or procedure. You'll be entered a newly wiped down room. We have always serviced our rooms, but due to the heightened urgency of COVID-19, we are paying even more attention to disinfection. High-touch areas, flat surfaces, chairs, beds, equipment, and even items like ballpoint pens will be disinfected. We want you to be at ease knowing that we do care about you and keeping you safe, but we must also ensure that our medical providers are safe and will not pass on the COVID-19 virus to our patients. Going the extra mile is what it's all about in our implementation of the COVID-19 Emergency Operations Plan here at Lafayette Pain Care Clinics and Surgery Centers. What you can do for us and anyone else that is around you today is the following. First, tell us if you think you've become exposed to someone that has flu-like symptoms, or if you know someone is declared infected with the coronavirus COVID-19. Allow us to take your temperature. And if your driver is ill or health compromised, we ask that they wait for you in the car. If weather prohibits, or if it makes this totally inconvenient for them, please tell us that they need a surgical mask to wear while they're waiting in the waiting room with you. If there are enough vacant seats, please consider sitting every other seat or about 6 foot apart. We will do our best to get patients in and out so as not to overcrowd the waiting room. We also ask that have no children in the waiting room, and if you have brought them, ask your driver to take them to the car or perhaps go outside if the weather is permitting. We are doing our very best to keep our waiting room free of patients closely packed together with possible carriers of germs or viruses. And we hope that you'll gladly agree to wear a surgical mask if we ask you to do so. Next, please go into the public restroom and wash your hands thoroughly with soap and water, and then thoroughly rinse with water. Following the World Health Organization's hand washing chart on the bathroom wall will ensure that you're eliminating any virus or bacteria from your hands. If you have never seen this chart or never heard of this concept, the WHO recommends this for all healthcare providers, and that is what we do here at Lafayette Pain Care and Surgery Centers. So please familiarize yourself with that technique and try it out today. I also want to say, please do not sneeze in the open air without covering up. If you have to sneeze, please sneeze into your elbow or a tissue. We prefer the elbow method, as you'll see in just a few moments. If you have a tissue that we provided in the waiting room, sneeze into the tissue, throw it into the waiting room trash can, And we ask that please do not leave used tissues lying around on the floor or on the table. Please wash your hands after touching that infected tissue. Lastly, please understand that if it is determined that your visit must be rescheduled due to concerns over COVID-19 contamination, we will reschedule you as soon as available and allowable, as well as take care of your pain medication prescription needs in the interim time period. Don't worry, we will not leave you hanging without your needs taken care of. I want to thank you for your understanding during this difficult time. Together, we will get through this safely and will manage your pain appropriately to your satisfaction. We hope the rest of your day is wonderful, and please be safe. And stay tuned for a little myth busting on sneezing and hand washing.
For stopping sneezes from spreading their wares, their germs, their bacteria, and that's what this rig is set up to test. Jamie and I will wear white suits, like I'm wearing now, and stand here at the apex, and we will sneeze. Of course, our mouths will be filled with colored liquid like before. We're going to try and prevent the spread of that sneeze with 3 different methods. 1, open hand, ha-choo. 2, into the elbow, ha-choo. And 3, something no gentleman should be without, a handkerchief. Ha-choo. We're going to be looking at our suits and on the floor to see which one works the best. Sneezing into the open hand. I'm predicting this is going to be kind of a horror show.
A swig and a sniff later.
That's one.
Yeah. Oh, there's another one coming.
For each style, they're going to unleash a sample of 3 sneezes.
Oh, it looks horrible, doesn't it? I look like a vampire. Ah!
Adam's face is a picture, but it's the canvas that tells the real story.
I see spots up to 8 feet away, dude.
Yeah, it did spread quite a lot, but there's a lot of markings here. So I'd say single hand, not so good.
Yeah, not so good.
Not so good, and then some. Even with his hand directly in front of the oncoming sneeze, Adam can't begin to contain the explosion.
Now, I'm pretty clear that sneezing into your hand is meant as a courtesy to those around you to keep from spreading your germs onto them. And as far as I can see, it's quite effective at doing exactly the opposite. I noticed there's almost no red dye on me at all, and crap loads all around me. If I was on a subway, I'm Typhoid Mary.
With the hand getting the thumbs down, can the elbow do any better? To find out, it's over to Jamie, and he'll be sneezing in green.
Now, we wait for the sneeze to take effect on Jamie's Hoosier nose. Slowly, it irritates the cilia inside.
And with the cilia salivating, three sneezes later, and the results are very impressive.
Yeah, I see only 2 droplets and 1 on your shoe, and let's look at your elbow here. That's totally localized to you, man.
And you know what? It's all on my arm and not on my hand, so I'm not as likely to spread it around.
Yeah, it's doubly effective.
Hands down, the elbow is a highly effective technique, with virtually the entire sneeze contained on each of Jamie's sneezes. But can the humble hanky do better still? Well, it's back to Adam, and for this final test, he's sneezing in blue.
How do we do? I see a tiny dot of blue there.
At first, it seems like the hanky may be victorious, until...
I see some on the hanky.
And look, it's penetrated all the way to both sides.
It's penetrated both sides, and perhaps most damningly, ooh, it's on my hands, ready to spread to the next person whose hand I shake.
The sneeze seeped through the hanky, contaminating Adam's hand, making it a pretty poor technique. And it gets worse.
Let me make one more thing clear about this hanky I'm holding here. Imagine, achoo, you sneeze in it all day long. You keep on putting it in your pocket, pulling it back out, giving people change from your pocket, handing them your pen, handing them your phone, talking on your phone, spreading Germs! Yeah, it's not just a Rorschach test, it's a petri dish.
Although the droplets were contained, the hand exposure means the hanky has hit the skids.
So, this flu season, which method are you going to use? The hand? The elbow? Or the handkerchief?
It's got to be the elbow.
I totally agree. It's the elbow.
So now you know.
There are over 12 million hand dryers in the U.S. alone. So can they really be a hygiene horror show? Well, the theory to this myth is twofold. First, dryers supposedly purge fewer pathogens than their paper counterparts. And second, they can also fan a fog of microbe miasma that's a contamination catastrophe. But will this myth be hot air?
This story doesn't make any sense to me.
How so?
Well, if you're drying your hands, that implies that you've washed them.
Absolutely.
And if you've washed your hands, you've removed all the bacteria. So whether a drying method is cleaner than another is irrelevant.
Right, I see your point, but only some people use the full soap and water for washing their hands. Some people, they just get their hands wet before drying them off. Why don't we test both of those and see which is the proper worst-case scenario for testing hand towel versus dryer?
Okay, that works.
So how do people wash their hands? Well, to my way of thinking, there are 3 things people do in a restroom regarding washing their hands. The first is they pretend to wash their hands. The second thing people do is get their hands wet, but use no soap. The third thing people do, and the thing we all know you should do, is wash their hands with soap. So first things first, Jamie and I are going to wash our hands using each of those techniques and compare the bacterial loads to see if Jamie is in fact right. Does washing your hands in soap and water leave them completely clean?
And first to go is Adam, who after each cleaning custom hands over to the Heineman.
I'm swabbing Adam's hands with a soy-based growth medium. So if there's any bacteria on his hands, I'm going to find it.
Once Jamie's also swabbed for science, it's time for some germination.
Okay, Adam first. The process is pretty simple. We've collected our samples, we spread them evenly across soy agar in a petri dish, and we put them in an incubator. We're going to let them sit there overnight. We'll come in the morning and see what we've got.
And sure enough, 24 hours later,
Let's see what kind of surprise we have.
All right, well, the soap wash,
Nada.
frickin' nothing.
yep, the soap plate's great, which cannot be said of the water wash.
How come your bacteria are bigger than mine?
Sometimes that's just the way it works.
And as for the no wash,
Whoa!